Yes, it's going.
Okay. Going.
Yay! Hi, this is Karen with Rain Dance Massage and Reiki. We're doing another video series today. Today I've invited my best friend in the world to give some feedback about a massage experience that she's had in the past. She had shared with me that she doesn't typically get massaged because it ends up hurting her more. And that should not be the case. And I hear that all the time with people saying, I'm scared to get massaged because I've been told I'm going to hurt more afterwards. And that should not happen. So I wanted to have Julia, this is my best friend,
Hi.
talk about how how massage typically made her feel. So, Julia.
Okay. This is my best friend, Karen. Right. Just like Karen said, typically when I get a massage, I end up feeling worse than how I went in to get one. So this was not fun. Typically, I'm hurting for about 3 days after a typical massage. The last one I got, which was about 4 years ago, I was hurting for a week, and I thought I might need to go to the ER. So I thought, I'm not going to do massages anymore, even though I've heard that she's the best, and she's definitely the best I've ever experienced, no doubt about it. After my experience with Karen, typically there's pain from beginning to end. I had no pain at all, and afterwards I've had no pain, and it was really enjoyable. Karen's got the best hands. They're really strong, and they get really hot. I noticed your hands get really hot, and it feels,
the Reiki.
I figured that's what that was. And it makes you feel like you're being healed of whatever is wrong with you. And I loved that. I didn't tell you that yet.
Thank you.
So I'm just telling her now.
Yay. Okay, good. I asked her to be completely honest because we can address it either way, whether she was hurting after the massage or not hurting after the massage. So let's talk about a little bit why people are hurt after a massage. There could be several different reasons. One of them is that the massage therapist is not warming up the patient adequately. So one of the things that I do is I use a hot pack and I kind of roll it up and down somebody's back, and then I leave it there while I kind of work around the body before I even start the massage. But I've got the hot pack and I do that, and then I do a lot of the kind of warming up strokes before I even do any deep work. And that brings to the other point. If somebody like a massage therapist is going in too deep too fast, where the body isn't warmed up, or they're not working with your body, not waiting for the muscle to give when they're pressing on it, then that's going to cause pain. Nobody should be working on you so hard that you're gripping the sheet or having tears or tensing up. That's all like way too much. So you need to find a massage therapist that's going to pay attention to those signs, and somebody preferably that has an innate sense of touch, which can't be taught. So, and we'll talk about that in another series or episode on what you should look for in a massage therapist to find a good one, someone that matches what you need. Aside from like personality connection, just, therapeutically what they can provide for you. The other thing that can cause soreness is hydration. Everybody, that's had a massage, they're always told to drink water after the massage to help flush out the toxins that are released in the muscle during the course of the therapy. But people should also be hydrated before they even come in. So a lot of people don't drink water before massage because they don't want to have to pee during the session, and I get that, but they try to structure like water consumption, maybe stop an hour before you go into your session, because that really makes a big difference. It's also easier to work on people when they're properly hydrated. So if Julia's experience had been that she was still sore from the massage that I did, there's several alternative modalities that can be used that can still provide healing and help somebody. So a few of those, like Reiki energy healing, which is something else that I did, and that's what Julia was commenting on with the heat coming off my hands. Yeah. Once you're attuned to doing Reiki, it automatically comes out anyway. When I'm doing massage, I don't have to formally do anything. So anybody that's trained in Reiki and doing massage, you're going to get some of the Reiki benefit anyway, which is a bonus. Yay. The other thing is like massage cupping. That works with negative pressure. So instead of pushing into the body, it's lifting the tissue up and releasing the fascia and moving toxins, getting rid of stagnant fluid, and bringing local circulation to those areas. So it's just as effective as deep tissue massage without all the pain. You could do hot stone massage. That is using the heat from the stone that is like a moist heat, so that gets in really deep to the tissue. So it's kind of like a whole other level of relaxation, but nobody is like pressing those stones really hard into you. At least they shouldn't be. So that's another way to get the relaxation without having to manipulate tissue. Another therapy that I do is manual ligament therapy. That is really gentle work, and that's, for the people that have had massage or this particular technique or done or is a massage therapist. It's a muscle energy technique is what it's called. The difference with manual ligament therapy is we're compressing on a ligament to activate the sensors in that ligament to facilitate the muscle relaxing. So the tendons will do that same response thing with the brain, but the ligament, they found, also does it as well. So that's what manual ligament therapy is, really super gentle work. Cranial sacral is another one that's very gentle, that can provide a lot of relief for people. So, if somebody is like after a surgery where they're contraindicated from having massage, if they have a situation where they have a condition like fibromyalgia with overactive nerves where they can't tolerate pressure or touching even. Any of the, like Reiki is really good for that. Cranial sacral is really good for that. So there's other complementary therapies that are beneficial without having to do massage. But the purpose of this episode is to talk about when you're getting super sore, that's possibly what's happening, is not warming up properly enough, the therapist is going in too deep too fast, or the patient isn't hydrated enough. So that's basically that, and we'll talk about more in future episodes. So thanks for watching. If you like the video, then like and share, and we'll see you soon. Okay,
Bye.
Thanks, bye.